morning. My name is Shirley Sebonego. I'm a physiotherapist here at Aurora Physiotherapy and Rehabilitation. I'm also the managing director here. I've been a physiotherapist for 12 years. I started working at Princess Marina Hospital, then I went to Gaborone Private Hospital, and then 4 years ago, Aurora Physiotherapy and Rehabilitation was born. Here at Aurora Physio, we want to set the standards for excellence for physiotherapy. We want the people to get first-class physiotherapy services, the one that they can get, if they were to go for physio abroad. It has been a norm that people who need intensive physiotherapy, they are taken either to South Africa or to somewhere outside the country for rehabilitation. So we want to be that go-to place where people can come for their rehabilitation. A lot of people do not know what physiotherapy is. So physiotherapy, we are a health profession that deals with movement. When doctors give pills and medicine, we give exercise. We teach our patients how to move in such a way that it helps to relieve their pain, it helps to restore their function. We want you to get back to what you were doing before you got an injury, before you got ill. So it's sort of like rehabilitation. That's what rehabilitation is. We want you to enjoy doing the stuff that you like doing without fear. So we teach you how to move. We use different treatment modalities. So we use exercise. We do have soft tissue mobilizations. We also have other things like electrotherapy where we also have thermotherapy. There's different, it's so broad. There's different things that we use. We also help with appliances or equipments, when somebody is not able to move, we are able to assist with how to use crutches, how to use a wheelchair, how to, if they need any assistance, maybe support on their joints, we help to assess and give them those. There are different specialties in physio. I'm not sure if specialties is a word that I can use, but there are different areas of physiotherapy. So we do have what we call pediatric rehabilitation. So pediatric rehabilitation or pediatric physiotherapy is anything that involves physio to do with children. So basically we want to create a fun environment where we teach children how to move. So we see children maybe with neurological conditions, with cerebral palsy, children with delayed milestones. We see children with club foot. We also see children with maybe after any surgery, be it orthopedic or be it general surgery. So anything to do with children and physiotherapy, that is pediatric rehabilitation. And one thing, parents, if you notice your child being slow, not meeting the required milestones for a certain age, don't hesitate to bring them to us so that we can help them to achieve the milestone that they need, the developmental milestone that they need to be at. Also do what we call sports physiotherapy. So in sports, we work with athletes, we work with people who play any sport at any stage. So we help them during their training to prescribe exercises that is best suitable for their sport. We also help them after they've had injuries, either in the field when they're playing or outside or during training. We help to get them back to a position or to a point where they are able to play and enjoy the sport that they love. So usually for sports people, we see they do get a lot of ligament injuries. So we see them either, if it needs surgery, we see them after surgery to rehabilitate, give them exercises, teach them how to move. We have to make the joint or the tissue that was injured, we have to make sure we get it strong, we get the joints moving, we get them moving the right way to avoid injuries. And what's important in sports physiotherapy, we don't only deal with injuries, but we also try to prevent injuries when they are playing. So during training, we look at how they are training. We prescribe exercises that would best prevent future injuries. We also see a lot of patients with strokes or neurological disorders. This is in the field of physiotherapy called neurorehabilitation. So with these people, the injury will be either to the brain, to the spinal cord, or to any part of the nervous system, the nerves, either after surgery or anything that deals with those. So with this part of physiotherapy, what we try to do, we try to encourage what we call neuroplasticity. So our body, our brain, let's take for example a person with a stroke. Our body already has connections, our brain has connections that controls how we do movement. So if you have an injury to your brain, we try to teach you how to do an activity, and then in that way your brain will make new connections and you'll be able to do that activity. And not only that, but we try to get you to be more independent. So let's say people who have been paralyzed, how do they become independent? How do they live their normal lives, move from point A to point B? If they're using a wheelchair, how do they get on and off the wheelchair? How do they transfer from the wheelchair to the chair? So we teach them those kind of things. We also ensure that we teach their families so that they give them support. They know what to do at home to help them with their transfers, moving from point A to point B, to encourage them. So it's teamwork between ourselves, the family, and the patient. There is a lot of misconceptions about physiotherapy. The main one, people think physiotherapy is massage. Like we get patients coming here and asking to be massaged. And what I usually tell my patients is that, you know what, massage is only like a very small portion of physiotherapy. It doesn't even scrape the surface. So if you go for physio and the only thing that you are given or you want is massage, then you are being robbed of the many benefits that physiotherapy can offer you. So for starters, physiotherapists, they know in depth about all the systems in your body. They are movement specialists. So they know about your muscles, which muscles start from where to where, how do you activate this muscle, how do you activate this muscle, how do you get this joint moving this way, how do we promote sitting. So there is a lot that physiotherapy offers, and massage is just a very tiny part of it. So physiotherapists and people out there should know that physio does a lot more. The physios They learn about movement. They learn about your brain. They learn about all the systems in your body, like I have already said. So physiotherapy is not massage, but massage is a tiny part of physiotherapy, but it's not the main part. The other misconception is that physiotherapy should be painful. It can be uncomfortable. What I usually say is that this is the pain that you are coming with, and we're trying to get it out. But physiotherapy is not supposed to be extremely painful. So what we want to build your body, like we want to relieve your pain in such a way that we get the body used to movement, but without aggravating the pain, without setting off the body's defense mechanism, because that will just make it worse. So what we do when we prescribe exercises, when we do any modality, we start with what the body is able to manage at that point. And then the whole idea is each day there should be an improvement. When your body, like if today you can move from here to here, that's okay. We can start from here to here. It's not painful, but the aim is to get gradual improvement. So physiotherapy is not supposed to be that painful. It can be uncomfortable. And then the last one, that is also, people think maybe physiotherapy is only for maybe to do with athletes and people who play sports. But like I've mentioned, physiotherapy is very broad. We deal with children, we deal with adults, we deal with people who play sports, we deal with people after surgery, we deal with pregnant women, we deal with a whole lot of things. So it's not just for a certain people. Physiotherapy in Botswana, what I can say is that, like I had mentioned, people do not know much about physiotherapy, especially in the rural areas. So in Botswana, physiotherapy is mostly common in like the cities and towns and maybe big villages. But as you go to the rural areas, people do not have that much access to physiotherapy. And in the future, I hope to see that change. I hope to see us as physios doing outreaches to the villages. I want to see us as physios setting up clinics in the rural areas. I want to see clinics, not just private clinics. I want to see like physio being available for patients in government clinics in the rural areas. The dream is for us as physios to also be recognized, to specialize. You know, like I'm very passionate about neurorehabilitation, and I know somebody who also has specialized in women's health, and then somebody will specialize in sports physio, and they're known for that. Like if I go for that clinic, I'll get this kind of service. If I go to that clinic, I'll get this kind of service, and that's what I'm hoping to see. And I honestly want our physio profession to grow. At the moment, there is not many physiotherapists in Botswana. That's why most of them are just in the cities. I just want to encourage the upcoming youngsters that physiotherapy is such a rewarding career. So if you may be hesitating or you don't know what you can go and study, you can go for physiotherapy. It has a lot of opportunities, it's still one of those professions that are still growing in the country, and then there's still more that it can grow into in the country, and I would really encourage you to go for it. In school who are aspiring to be physiotherapists, you have to do well in your maths and your sciences, as well as your English. You also have to have a passion for helping people, because physiotherapists, we get into people's personal spaces. So you need to be open to talking to people and just generally have a passion for interacting with people and helping people. We are Aurora Physiotherapy and Rehabilitation. We are located behind GSS, behind Bokra, opposite Karung Clinic. So if you're coming from the museum, you turn the first right turn after Bokra. If you're coming from that side of the museum, and you'll just follow the signs, you'll see our board. We're just opposite Karung Clinics with a white wall. So you can contact us if you're looking to make an appointment. You can contact us on our landline, which is 397-1146 or 77628-859. So the services that we offer neuro rehabilitation. We have a gym that we use. We offer pediatric rehabilitation. We offer sports and orthopedic rehabilitation. So those people who have had surgeries for their backs, for their knees, for their anywhere in their body. So we offer physiotherapy. So if you're suffering from back pains, neck pains, or have broken bones, you can come and book an appointment with us. Thank you very much.